As flames continue to carve a path of destruction in Southern California, many survivors are returning to their communities to survey the damage and try to pick up the pieces. This morning, we are taking a look at how natural disasters like this can have lasting psychological effects on people. Joining us now, Dr. Sue Varma, a board-certified psychiatrist and author of the book, Practical Optimism. Dr. Varma, thank you so much for being here with us, especially on a day like today, on a week like this week, when people really need to know how to process what's going on, because everyone seems to still be stunned, understandably, by what's going on. What are the symptoms people should be looking out for trauma?
Yes. So symptoms may emerge within days, within weeks, sometimes even months. And we see that people will have symptoms of anxiety, depression, insomnia, hypervigilance, feeling very startled very easily, nightmares, avoidance of reminders, triggers, irritability, anger, maybe lashing out, maybe increased substance use.
But isn't that what anyone would be expected to feel after going through something like that? How do you know if it's just the normal
Yes.
response, a typical response of experiencing something so life-changing versus something more long-term trauma that may have to be addressed?
Yes. So we don't want to stigmatize anybody. These are the most devastating and extreme circumstances. And so anything is possible at this time, but you really want to look at whether there is impairment in functioning as a result. So if somebody says, I just have these really intrusive thoughts that like a fire is going to happen, or I'm reliving or re-experiencing these memories to the point where I'm not able to function at work, I'm not able to have a conversation, I'm not able to look for employment anymore, I'm not able to pay my bills, so I can't get through the day. So I would say if you're finding that your functioning is impaired for like 2 weeks or more, and depression is persisting, or you can't sleep at night, I would definitely get help. And sometimes for some people, it could just be even a few counseling sessions that go a long way.
One of the things as journalists we do is we cover natural disasters, we cover wars, and we run across this phenomena where people have survivor's guilt. In other words, in this particular instance, it could be that an entire neighborhood is obliterated, but your house is still standing. How do you process that feeling that for whatever reason you have survived something, but your neighbors and the people that you love have not? How do you work through that?
Yes, it is so hard, and I can say that both things are possible. Gratitude and grief can coexist. And you can have grief for the people around you. It doesn't have to be that you personally experienced it. We know that people who witness wildfires and were not impacted beyond just the witnessing still have symptoms later on. People who were told about 9/11 in another country were impacted by it. So we really are a society that is social and, for the most part, caring and empathic. So I would say, is there a way for you to channel the survivor guilt into something impactful? Can I advocate? Can I help? Can I offer? For a lot of people, getting outside of their head and outside of the ruminations and finding some productive way to channel it, volunteering, offering care packages, offering your home, offering money, water, food, shelter, clothing, anything that you have to give, it makes you feel needed and wanted and productive, because it's about helplessness and you want to take back a sense of agency.
You know, I was thinking about this while watching the CBS Evening News last night with my family, and my daughter, who's 3 years old, is watching these images. What should parents at home be doing? Should we not be letting our kids see these flames? Should we talk about them? What do you recommend in just a few seconds
Yes.
left?
Age-appropriate conversations, I think, under the age of 7 or 8, really limit the exposure to these images and just say there's something going on in the world right now. And I think it is helpful for kids to understand what it means to pack a bag in an emergency, but really like age-appropriate conversations. What's going on in the climate? What's going on in the environment? How are these things going to have downstream effects? But I think for some teenagers, activism and advocacy can be a helpful way to take back some of that control and in the form of action.
Love that advice, as always. Dr. Varma, thank you so much for being here with us. We always learn so much when you're here.
Yes.